Okay, this is just a quick and by no means my most professional video on just how to set up the Isokinetic software for your upcoming assessment. So remember that you have an option of 3 different tests that you'll be able to perform. So just to familiarize you with the screen here, this is the standard talk time graph that we see, which presents all of the information that you can see in real time. Up the right hand side here in the top right hand corner, the only thing you really need to concern yourself with is this option that says anatomical. This shows you some of the instructional videos, not the best quality, I've got to admit, but you do have the option, if you so wish, to view these for your assessment. Obviously it's advantageous if you don't use these. It's not going to benefit your grade because it is showing you what to do, but you have the option to view any of these. You just need to mention it during the assessment, but there's no real need because the information that's contained within these videos you can just jot down on a prompt card or something similar. So other than that, really we need to work our way down this left hand column. Remember that the protocol will be selected for you. First thing we need to do is enter the patient information. So you need to go to add patient and make sure that you fill in all the information that's highlighted in red. So I'm going to try and do this with one hand, if I can spell my name correctly. So we need to put in the participant's last name. We need to weigh the participant beforehand and enter their weight. This is important for measurements like talk to body weight ratio. So it's important that we accurately input this information. For your assessment, you do not need to weigh your participant, but you may wish to mention that among other things like a thorough warm-up, like a familiarization session, that you may wish to record your participant's weight. Height isn't necessary, or it's not under the essential information. You then need to assign them an ID. This can be anything. This file will be deleted afterwards. You then need to determine or identify the participant's gender. Whilst this isn't highlighted in red, it's important to emphasize which limb is their dominant side, be it their left or their right. So if this is the lower leg, or sorry, the lower limbs, I should say the lower leg, the lower limbs, you can ask your participant which leg they would kick a football with, or just get them to step towards you and, well, you put your best, your dominant foot forward. You then need to assign an involved or uninvolved limb. Now the involved limb is defined by you, the technician or the biomechanist or whatever you want to title yourself as. This is either the dominant limb, which we've already assigned here. This might be the injured limb. This might just be the limb of interest, whatever it may be. It's entirely up to you, which you could then note down in the clinician's notes here as to what is meant by the involved limb. So this could be, let's say someone's recovering from an ACL rupture in their right leg, then you would highlight the right leg. If they had, I don't know, injuries in both limbs, you would highlight both, or if they're perfectly healthy and nothing's wrong, or it's just a general analysis that you're looking for, then you could select none. Once we're done here, we hit save, and we have entered our participant information. Anything else isn't necessary for your assessment, but we might want to make use of, so the participant's first name, date of birth, contact details, things like that. Any notes you might want to make. If they're in pain, you have a pain scale here, so you can ask them on a scale of 1 to 10 how much discomfort they're in. This can be before, during, or after the test, whatever the scenario calls for. The protocol will be pre-selected for you, but if you are unsure of what the protocol is, because remember this is something that you need to tell your participant when they come in, you must not assume they know what they're doing, okay? So for the If you are given the knee flexion extension test, this is isokinetic knee. You don't need to know where this is, but just so you know what test you're getting. It is a bilateral isokinetic test. It's under here, under one that I've created. It is a concentric test. That's concentric extension, concentric flexion at 3 different angular velocities: 360 degrees per second, 180 degrees per second, and 60 degrees per second. Your participant doesn't need to know the specifics of the angular velocity, so you could just simply say fast, medium, slow. Remember that they are given a familiarization set of repetitions before the test is conducted. You're not going to conduct the test, but they are going to have to perform, or they would have to perform, a familiarization set, okay, at 20 to 30% of their maximum effort. So this information, just close this off. The information about the protocol will be here. Okay, so when you come to explain it, there's, the information that you need is presented here. It's an isokinetic test. The joint being assessed is the knee, flexion extension, or extension flexion, I should say. Concentric. Number of angular velocities, or number of speeds, is 3. Number of repetitions is here, so they'll perform 10, 5, and 3 repetitions. You can ignore everything here to the right of 3. And the away and toward speed will be the same, but you could alter this if you wanted to. The starting position is at 90 degrees of knee flexion, and the rest period in between tests is 60 seconds. Okay. The protocol for the ankle test comes under isokinetic unilateral, ankle inversion, eversion, and it is the first test we see from this drop-down list. Again, this will be selected, but just so you know what to prepare for. Just need to exit this. It always goes straight to set range of motion, but you can just close that. So again, this is an isokinetic test. It's for the ankle, eversion and inversion. So it always tells you what movement to start with. So your participant should start by everting, then inverting, okay? It's a concentric again. There are 2 sets this time, so again, you'll ignore everything to the right of 2. 5 repetitions for both tests, and in both cases, the angular velocity is 180 degrees per second. There is a 20-second rest period in between. There is the anatomical reference position is with the dynamometer attachment pointing upwards, so vertically up in a neutral position, not in inversion or eversion. Don't know if that helps me showing my fingers, but there we go. Finally, if you have to, or are given the shoulder internal, external rotation proprioceptive test, that is here under proprioception unilateral. It is an active test. So just close this. Oh, gone and opened it again. Not on the ball today. So in this case, it is a proprioceptive test for the shoulder, as we said, internal, external rotation. And it is performed at, you're going to perform 3 different repetitions. You hold that position for 10 seconds, and the target position is 75 degrees of external rotation each time.